not normal. Another point in time when it's not normal is if it happens in your early 40s. So if you're having it at 40 to 45, that's considered early, but not as bad as in your 30s. And then you have something that's induced. So women going commonly in terms of women going through cancer treatments. Breast cancer is another big one that affects women, and treatments for breast cancer can push you into menopause, or we put you into menopause for that treatment. Severe endometriosis, we induce it, we give you medications to induce a menopause to help with your symptoms. And then there's the big one, surgical. I caused it. Something happened and I had to take out your ovaries, and immediately I did that. You would have no estrogen. You've gone into menopause. So, yes, it's natural, but it can also be unnatural and caused by medical treatments. So, oh, that I explained. I went through all of those. Yeah. So, menopause symptoms. And persons just, as soon as you hear menopause, they're going to say hot flashes. It's not only that. That's the worst one. It's the most bothersome one. It's the most easy one to detect, pick up, but it's not the only one. And it's also important to note each person experiences menopause completely differently. You might see your friend going through absolute terror with her menopause, and you are not. And a lot of times you'll be like, so why is she going on like that? It wasn't that bad. But you are different. So I want you to always understand that I'm telling you everything. You may have one, two, none, or all of them. So I I talk about this all the time in my clinic. So if I stray from the presentation, that's okay. I'll just talk. So a lot of times persons are like, okay, how will I know? Oh, thank you. Which one do I press? This one? Okay. So a lot of times persons want to know, well, how do I know if I'm going through menopause? So it starts with the symptoms. So you remember that perimenopause I told you about? And that's when you start seeing to notice the symptoms. That first one on the list, irregular periods. So you notice that your period that usually comes every month like clockwork decides it wants to have a mind of its own. It comes the beginning of the month, the end of the month, skip 2 months, come back, hang around, gone again. And that's typical how it behaves. And I like to liken it to tell my patients, and I liken it to a tap turning off. So when you're in your nice fertile years, you have a good stream, a good flow, that's your periods. Before you even start to skip the periods, you notice that they become very light, very manageable. And you'll probably be like, so where were when I was in my teens? I never knew periods could be so nice. And then afterwards, you notice the skipping. So that's when the pipe is now dripping, coming and stopping and coming and stopping until eventually it stops. And when it stops, that's when you've gotten to your menopause. When you're in your drip, drip, drip phase, when the time frame between each period is expanding, so you might skip a month, you skip a 2 months, you skip a 6 months, that's when the hot flashes come in. And you can skip as much as 9 months, and whoops, it comes back. Hot flashes come with cold flashes. So the hot flashes are the heat, you sweat, evaporation is a part of the evaporation of the sweat that you produce is a cooling mechanism, so then you get a cold flash after that. When it happens in the night, we call it night sweats. It happens in the night, your sleep get disturbed, so you're not sleeping well. Oh, sorry, I forgot. So most of what I just described is what we call vasomotor symptoms. So that's the fancy name for hot flashes, night sweats, cold flashes. It's a fancy name, we doctors call it that. And that's what it is. And I have not had, I don't want to say the pleasure, but I have not experienced menopause. But my mother is my best friend. And I lived with her and I went through my ONG specialty when she was going through menopause. And that triggered me to learn everything because I saw a hot flash. And when I saw that hot flash, it was so severe, I thought she was having a heart attack. Yes. And she turned and told me I was embarrassing her because I was calling the ambulance and we were in public. So it's just, I like to put a little light spin on it. So we were shopping And she was walking with me fine, and all of a sudden she's not beside me. And I turn around and I literally see her like holding her chest and looking. I'm like, Mommy, are you okay? And me in my medical place just noticed her face was pale. She was sweating all over. And I'm like, oh my goodness, she's having a heart attack. We're in a furniture store. There was a lady, a sales rep, sitting there, and she had a fan. And I pushed the sales lady off her chair, put my mommy in front of the fan, and said to her, call the ambulance. And all my mother looked at me and said was, you're embarrassing me. I was like, I'm trying to save your life. What you mean? Because I didn't know she was going through this. She didn't say a word to me, despite me being a doctor in the specialty. She said not a word to me. And all she said to me was, I'm having a senior moment. The lady who I pushed off the chair heard, understood, and said, it's okay, you can stay. And that's how severe they can get. So I didn't say anything. We went home. I said, Mommy, what? Why didn't you say anything? Well, and this is why it's now a big topic. I don't know what to say. My mommy didn't tell me. So it's generational for you to suffer in silence as a woman. My mother didn't tell me. She kept it to herself. So I'm not going to, disturb and disrupt my child's life. I'm not going to say anything. So I pressed a little more. What does it feel like? Oh, sorry. So that's what I wanted to show you. I don't know if anybody has seen this video, but you see steam coming off this lady's head. She's having a hot flash in a cold environment. That's just to show you the severity of it. I don't remember if a slide has what it feels like, but okay, not yet. So what it felt like, she said, is like a steam or a heat coming from your chest. That's why she was holding her chest. So it feels like the heat is coming from your core. And it happens in an episode. It lasts a minute or two and it goes away. So you feel like this heat, steam is coming from your chest. You might have your heart racing. Then the beads of sweat come on. We would call it cold sweat. So you have cold sweat and you literally feel like, oh my God, what's happening? And then it just goes away. And that can happen as often as 7 times in the night. And remember, I said after this comes the cold sweat. So if you're nice and snugly under your blanket and you get a hot flash, the first thing you're going to do is throw the blanket off. Oh, my goodness. And then you have the cold spell. So the blanket you throw across the room, now you have to get up and go for the blanket and come back over. And if this is happening 7 times a night, that's not fun. Some persons come up and say, look, I have to get up and change my nightgown because it's wet. So they have to go to the bathroom or your closet and you change it. So that's not fun. And that leads to the next one, which I know I saw. Am I turning this backwards? All right. The sleep disturbance. So you have the sleep disturbance from the night sweats in itself. And then you have the sleep disturbance just because of other aspects of your menopause. So it's almost as evil as it's a domino effect. One thing leads to the other, and one thing. So you can have the sleep disturbances and not have the hot flashes. And if you have the hot flashes and you have sleep disturbances, it's worse because one is feeding the other. So 30% of women will just have sleep disturbances alone. It will be worsened with the hot flashes. And then I think my next symptom, I'm not sure if it's coming up next, but it's on the slide, so I think it is. The next thing that menopause affects is what we call your genital area. So your bladder and your vaginal area. And for the bladder, it makes you not hold your urine as well. So you have to get up and pass urine more often. Right. So you have to get up and pass urine more often. The vaginal area tends to feel uncomfortable. So it just feels like you don't want to wipe with a tissue. It feels very tender and sensitive. It's dry. You might have more vaginal infections because of the changes to the vaginal area because of the menopause. Intercourse, so interpersonal relationships. This is where men come in. Interpersonal relationships get affected. So on top of having hot flashes and night sweats and I'm drenching in sweat and I can't sleep properly, I feel uncomfortable. The last thing I want is anything intimate. And then If I do decide that out of duty I'm going to do this, it is painful and uncomfortable. And that's all of that. From the bladder to everything, that's all grouped together as we call genitourinary syndrome of menopause. So, and those are the things I listed. You have dryness, burning, pain, lack of moisture. So all of that was what I had listed. And if you see the last one, it says you're passing urine more often. So on top of your 7 hot flashes for the night, you're not sleeping good. Every minute you have to go to the bathroom to pass urine. Doesn't sound very nice. This is me continuing to talk about the physical changes. So I told about the functional changes. It's dry, but it physically looks different. You'll notice it's thinner into the hair. So that's one good thing. Your wax lady needs less visits to save some money. You have less pubic hair. You have shrinkage of what we'll call the lips of the vaginal area. Guess, but that can be very painful because now everything is just fused and it's very thin, dry skin. So that's discomfort. In terms of what I said, in terms of intercourse, the vaginal, everything shrinks, so the opening gets a little smaller. So that's adding to the discomfort and the pain. And with the discharge, well, that increases your risk of vaginal infection. So some persons come and be like, I've lived my whole life, I never had a yeast infection. I never had to come to the doctor for that. Why now all of a sudden I get 3 in the past 6 months? That's it. And that can affect up to 50% of women. So you're 50% of women with menopause. So you see how everything is just adding. So you're not sleeping well, you're having these hot flashes, you're having discomfort every day, your underwear is feeling uncomfortable, you're having interpersonal turmoil with your husband because, we suffer in silence, so we're not going to say is what. And you look at all of these things, and all of these things are adding. That was the concerns I had said before. So I had mentioned all of the physical ones. This is now the emotional ones. That's going to put all of what I had said before, that's going to put a stress on you. You're worried about, am I healthy? Am I not? How is this affecting my relationship? I'm now getting old because you figure it out after a while. I'm getting old. Do I look old and saggy? That's the body image. It's starting to pile. If you're taking certain medications for certain things, hypertensive medications, other things that can add to the discomfort and the dryness, and you're adding this, if you had a medical condition before, is this affecting my high blood pressure? Is this affecting my diabetes? If you have a mental health illness, it's adding to that. So you have a lot of things going on. And if you have all of these cogwheels going in your head, it's not nice. And that's where we get to this. So I've put it in this situation, in this kind of order for you to reach how you'd get here. So you have all of this going on and you're seeing nothing. And if you already have a predisposition to a mood disturbance, anxiety, depression, you're adding to it. And if you didn't have it before, you sure have it now because you're anxious. Are people noticing me sweating? You're in your board meeting, you come in your fancy suit and sweat drenching down. Are they knowing what's happening? I'm sweating. So you have anxiety. You have depression because some co-workers can be mean. Why she come every day miserable so? They don't know what's happening. So you have all of these. And then that's also an excuse. It's not really an excuse, but it's an explanation of why some persons can be more easily irritable at work. As I said, I've never experienced this, but there are 2 stories I like to tell when I get to hear in my counseling. One was my mommy. My mommy was what I would say was a bulldog. She was a don't take any, disrespect kind of person. She ran committees. She was a teacher. She was on, teacher's board, everything. And if you blow on her, she cry. I remember driving with her, the taxi man blow her in traffic, she stopped the car and she cried. What is wrong with you? This was all happening. I didn't know. I had a co-worker who was also a patient come into my office, want an emergency appointment, and she comes to me, she says, something is wrong. You need to send me to psychiatry. I get up to go to work, nothing is wrong, and I'm just bawling down the place. I put myself together, go inside. My co-worker said one thing to me and I had to run to the car and I had to hide in the car for about half hour. I'm just crying. something is wrong, I'm losing my mind. And I just asked a few questions, like, you're not losing your mind. But that's the first thing that you think, something is wrong with me up here. And if you already have a predisposition to it, it's worse. So all of these are all part of menopause. So a lot of these things you have to sift your way through. Remember I said it's different for every person. You have to sift your way through and figure, is this really this person having a mental breakdown or is this just her menopause? So that's what I just went through. So in terms of all of that, you're going to have the difficulty concentrating at work, the anxiety, the stress, the discomfort. You'll have forgetfulness. And I don't mean just, where did I put my car keys? You're forgetting big things, things that you do every day. You're trying to write something, you can't remember the word. I remember when I was in the digging into, my mommy is having this, let me help with this, let me figure this out. There was a woman who, she was a big, running a Fortune 500 company, had a big meeting, I have a big meeting with her investors. And they called her and she was in her fuzzy slippers and her pajamas in the house. She forgot she had the meeting. So you're forgetting big things. To add to your discomfort, and persons might come in and panic, I think I have breast cancer, you have discomfort. Your bra is now your enemy. You don't want to wear it, you can't lie. A patient actually said to me, I can't lie down on my tummy in bed because it's tender and painful. And we are all self-conscious about how we look. So on top of you worried about aging, all of this is going on, just throw something else into it. The lack of estrogen makes it harder for you to lose weight. So you're now starting to gain weight. How I found out that one, my mom said, I was always small and petite. I've gone up 2 bra sizes in the past couple of years. Your breast is a lot of fat. She was just gaining weight. My mother was the envy. I saw a college picture of my mom, and she had the biggest, fluffiest afro. My mom's hair started to thin. So the ladies whose hair I envied, to the point I was like, so why you couldn't give me your hair? I saw it coming out. She just combed it out. She had to stop straightening her hair because of it. And on top of it, she said, so why the hair won't grow up there, but it's growing on my chin? No, you're losing your estrogen. That's our feminine hormone. But we make all hormones. We make masculine hormones. That's dropped to a sense, but the estrogen counteracted it. It's not counteracting it as much anymore. So you tend to get these things happening. So all of these is happening in a woman. And remember, we are mothers. We have other things going on. I know it's menopause. It'll ride out its storm. I'm going along with life. And that's what happens. So this was me talking to you about the brain fog, how it affects it, how everything is tunneling to each other. So if you have your vasomotor symptoms, your depression and anxiety, that will now affect how your brain works. It's tired. Your brain is tired from doing all of that. And this is how you know, is this happening to me or is this something else going on? And I had tied it into the period. So that's usually a very big clue. This is tied into my period. So if this is all happening when my period has gone rogue and is doing what it wants to do, probably this is what's happening. So as I said, when you start to skip your periods, this is what happens. But remember, I said there were special groups of women who this doesn't happen to them naturally. So if this is happening to you and you're 35, something's wrong. This is not menopause. If it's happening to you in 40, it could be menopause, but it's still menopause. It's early menopause. It should still come. I tell my patients if I'm doing certain surgeries on them, when you come back in 6 weeks, I'm going to ask you some questions. Don't think I'm strange because I'm expecting that this surgery may trigger this to happen early. Or if I take it out completely, I'm just like, when you come back and you heal, I'm going to start you on your hormones because I know I'm throwing this on you unsuspectingly. I've had it with persons who are going through their breast cancer treatment. And that one is a trick because the treatment for those symptoms, you can't really get if you're going through breast cancer treatments. So you have to go and think now out of the box in terms of your treatments. So how you would know, one is by symptoms, one is by doing a blood test. One is by doing a blood test. So if you fall into the category of Doctor took out my uterus when I was 40. So I not seen my period since I'm 40. So how am I going to know? Because you said I was to trigger these symptoms to when my period stop. So for those patients, we can't use that. So we have to use a blood test. So your doctor, you might come to your doctor, and even if you're going through it naturally, it's like we're going to do some blood checks because these symptoms can be mimicked by other things. Can be mimicked if you have a thyroid issue or some other hormonal issue, and so we still have to rule it out. So your doctor is going to do a blood test, and still we can miss it. I remember I said the pipe is dripping and stopping and dripping and stopping. If I just so be unlucky to order your blood test on that month when you're over released an egg, well, it's look normal. Your labs will look normal. So it still is it's like an investigation. You're adding all these things together to say, yes, this must be it. So there's no reliable 100% diagnostic thing. You have to come in and we have to do it together. And we also cannot reliably say, okay, based on your blood test and your symptoms, yeah, you're kind of perimenopausal. All right, so when it's going to finish, I don't know. There's no way for me to tell you when your last period is going to be. So you can see that it is also a work in progress for us as physicians, and we have to take each case as a case by case basis. So I like to pause here because I think that was a lot. Anybody have anything to ask yet? Oh, that plenty. I was
Okay, good evening again.
Good evening.
Okay, please be patient with me. Um, when I come here 2018, from 2018, I come back here in the island. Um, but before I come here, I noticed I wasn't seeing any period. So I don't know what name menopause. I just know that I wasn't seeing any period. And period, or period. Okay, period. And I never really know what is menopause, and I don't understand anything about menopause, and I don't feel anything about those things. Okay, all I know was seeing any period. So they say probably it stopped. It stopped. Okay, so while I was here in 2018, I said, I reasoned with one and two ladies, and they say, you're not seeing any period, so probably it's your menopause. So I say, I'm menopause and I don't feel anything what menopause is all about. I don't have no experience what menopause is all about. I just notice I'm not seeing any period. Yeah, because I'm in my 50 now, soon it's going to my 60. So when I come here 2018, I wasn't seeing it. So when I hear about this menopause, and I start to fret. I say, Lord Jesus, me don't know. So me and my husband separate before I come here. So I say that I hear everything what people saying about menopause, what it this and it that and it that. So I was saying to myself, I don't have no more use now to man because I'm menopause. So I was a bit tidbit, and I want to know how my body feel again because I'm not seeing any period or anything. Anyhow, when I come here, I met this Caymanian guy, and man, he did want me and him to get married and so forth. But I never love his attitude and his behavior. And, and he want to have sex with me, fight, he about to fight me off for it and everything. Anyhow, one night I just low him, make him have his way. Why I do that is because I said, I want to feel or this feel again. Because they say you're menopause and then say all kind of something and it make me feel down and oh like me don't know. Me not have no more use to man. Because they say menopause, this and it, that. And me not have any experience of it. Charge again. That then, me still have, it's
Okay.
just, it's just, I me and him fall out. And I get baptized. And I'm in my church now as a Christian. I want, I have it in mind that I want to marry it again. So I say,
We'll get. Yeah.
Yes. That pipe.
Right.
Okay. Can
Hold,
look how much
wait.
time you
Oh.
get. We not have the whole evening. She said in the next episode. She said she coming up with it.
Not the
Okay.
next side, the next section. So I stopped here because the other section can be a little bit
Yes, I
overload of
notice the
information. Yeah.
pipe.
Right.
Just take time and stop.
Right.
What if the pipe just lose the washer and it just hemorrhaging?
That's a very good
Yeah,
question.
and
I
and
like that.
and the other question about
Yes.
that, can you like you close to that to experience menopause, but maybe you get a tragic news suddenly and immediately the pipe let loose. Does this and it continues like for weeks and you suffer for more than a year like that.
Mm-hmm.
Is that natural?
No. In one word, no. And you are one of the persons that I like to emphasize that drip, drip, drip as a natural process. So it is normal, healthy. You're supposed to go from heavy flow to light flow to drip, drip, drip to stop. So how I approach this in clinic is everything is by age. And as you age, your well woman visit changes. So what I'm doing to you in your 20s when you come to the visit is not the same thing I'm focusing on in your 30s and 40s. It's not the same thing I'm focusing on in your 50s. And that's how I introduce it. When you reach to your mid 40s, I will say the drip, drip, drips and stop story. And many a time, just like what you just did, but that's not happening to me. If you said that I'm supposed to be experiencing that, it's the opposite. It's getting heavier. And that's when I start to investigate you not for menopause, but for some pathology, meaning something wrong. And it can be fibroids, because that's common for increased bleeding. It can be something that we don't talk about as much. It's like a cousin of a fibroid, a polyp. It can be something hormonal. So you said an emotional trigger started this. All of your hormones come from signals in the brain. All of your emotions come from signals in the brain. So if you have an emotional trigger that can cause your hormones down the road or down the trigger of things to be imbalanced, for a better set of a word, and it's causing the lining of your uterus to become thickened persistently and you have heavy bleeding. None of this is normal, and this is something that requires treatment. So if somebody tells me, no, I'm not doing the drip, 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 stop, I'm doing the opposite, that's something that needs to be investigated, find out what the cause is, and treat it.
So can you not get treatment?
Yes, you can, but you remember I said everything is different. I wouldn't be able to just tell you off the bat what it is. I'm going to
Right.
need to do further investigations and checks and figure out which one. Remember, I gave you a list
Well,
of
well, you hit
possibilities.
it because what I know, the case that I'm talking about, yes, the doctor after X-ray examiner and stuff, the doctor said it saw 5 or 4 little fibroids
There
coming.
you
So,
go. Okay. So that
but
so
then just leave.
she has similar problem that maybe she don't understand. She, I don't understand her symptom, but it seems like it's something similar at what you're saying and develop fibroids. But does that can lead to blindness?
Blindness?
she's not blind.
No, no, fibroids don't lead to blindness.
Yes, I do understand that for a woman who had an hysterectomy,
Hysterectomy,
yes,
yes.
that woman would not have any period. But while the person is in the age like late 40s, early 50s, would that woman still experience the symptoms of menopause?
Of course.
Okay,
So that
even, yes, so
so
even,
that is where I had come in, I think, I remember. But that is where I said that that would be a little bit of a trick to us.
right.
So that is one of the persons that you're like, you're not going to experience menopause like everybody else because you have nothing there to drip, 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 stop. So you are going to start to notice the hot flashes, the
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 confusion and
vasomotor symptoms, the
everything.
genitourinary symptoms. You might come in for something else, and I'll be like, uh-huh, you're going through
Yes,
menopause
like
now. You're
frequent
also harder
visitation
to
to the
diet,
doctor and,
right?
unable to understand what is
And you're
really
also the
happening.
ones that would be a little more difficult to diagnose because I can know that if you're just skipping 1 and 2 months, I'm not going to do a blood test on you because chances are I'm going to pick up something that's not diagnostic, but I would know where you are in your drip, drip, drip. So I have to combine your age with your symptoms, how long you've noticed them, the intensity of it. Because remember, I said in that 12-month break, that's when it would be the worst. So I'd have to time it with that and then do the blood test. And your blood test might still come off a little shaky. So I can be like, you're not fully there yet because this is not in the normal range, but you're on your way because it's not in the abnormal range. So we have some time when you reach the unbearable symptoms, come for treatment. So that's how we would do it for somebody in that category. Okay.
My turn?
Oh, sorry.
Yes. So two questions. The first is, does menopause contribute to an increase in blood pressures? And the second one is for someone who is on hormone therapy and is asking if changing the estrogen patches regularly affect hormone balance and make brain fog and concentration worse.
You're jumping ahead of my presentation.
Okay, I will have
But
them wait until you get there.
the second one, I think they'll both be answered in this. If not, and the person wants, or because I see you reading from a phone, they can re-ask, but it's gonna come up. That's why I
Definitely.
stopped because there's a whole another set of stuff coming up. Okay, so now we're going. Oh, sorry, sir.
Yes, miss. Excuse me. We came in a little bit late, so I see you had perimenopause and menopause, but the peri, we don't have an idea what the peri really means because we came in late. So
Okay.
I don't know if you could just give me a brief rundown on what the
Right.
perimenopause.
So menopause, as I said, is the end of it's just marking the end of your fertile years when your ovaries stop making eggs and right. So it comes in 3 stages, and perimenopause is the first stage of it, and that's when the ovary is on its last. So you're infrequently making your hormones and they're fluctuating.
Thank you.
Last one. Mm-hmm. Yes. So I didn't list. So if you looked at the first slide when I had said it's not just hot flashes and I had it floating around, slide was exorbitant. So I went through the most common and the most ones, but they do have some other nitty gritty ones along the way that kind of you're like, yeah, that's contributing to it. And fatigue. What was one of the early things I said vasomotor symptoms cause? Sleep disturbances. So if you're not sleeping well, you're obviously going to be fatigued. So yes, that is one. No. Okay. So right. So this will help to answer some of one of your questions, which was the long-term effects of menopause. Oh,
So, is it possible for a woman to go through period and even menopause without seeing any disruptions to her cycle?
you mean not having any interruption in her menses? That would be one of the ones that was like my friend there, which will be something unusual. So it can happen, but we have to rule out that this is not something abnormal. So like I said, it should never be just you just wake up one day and it stop forever. There is a transition. So if you're not transitioning normally, something is causing that to happen, which is what we consider to be a pathology. Did I answer that? Okay.
Because of
The hair loss,
yes, that you spoke about,
right?
menopause,
Right.
the hair gets thin.
Mm-hmm.
Is there treatment for that?
Yes, there is. I actually did not go into it with my treatments because it's one of the. So you're technically still treating hair loss. It's menopausal hair loss, but that treatment is not different from somebody who is having hair loss in their 30s. So it did not come under my menopausal treatments, but yes, it can be treated.
Um, is there any link between women, or I would say a woman, if she has her period early or late in life, depending on when the menopause start, and breast cancer?
And breast cancer. Okay. So those are two mutually exclusive things. So breast cancer is a genetic component. So that's something in your genes, which you're born with your genes, and depending on how your genes choose to be expressed, is if you are going to have or develop breast cancer or not. So that's hard to tell. The way they are connected is genetically, your menopause experience will be similar to your mother and your sisters. So in a similar way, if your mom and your sister has breast cancer, chances are you're at risk of it. It's a similar way if your mother and your sister has early onset menopause, chances are you may have that as well. And in terms of starting your periods early, and if that's a clue to you having an early menopause, yes, it is, because we all are born with all our eggs. So from you are born, you're almost predetermined to know how many eggs you have to last you for your fertile years. So if you start releasing those eggs because you're menstruating earlier, your eggs are going to finish earlier. No, ma'am. Everybody is different, so no. Something similar, which is andropause. It's not as pronounced as menopause is in women, but I also have, guess fortunately or unfortunately, experienced a man going through that, but for a medical reason. My father is going through chemotherapy that cuts off his hormones in a similar way that menopause cuts off our hormones. And yeah, they do get hot flashes. And my mother laughed at him because she did it. She went through it and he didn't know. And then he started on his medications and she just kept seeing him. And he's like, I don't know what's wrong. And she goes, it's a hot flash there. So, yeah, they do have it as well when they go through their drop in their hormones. For most times, men, it's medical because it never drops to the level of what would cause a hot flash naturally, but they do go through it. Okay, so we're going to go through what do all of what I discussed before has an effect in the long term. And most of these long term effects, remember I said the major hormone that is responsible for all of those symptoms is your estrogen. For most of the cases, I'm talking about the long term effects of having low estrogen levels. So there we go. So in a nutshell, your estrogens don't just target, for lack of a better word, your female organs. It targets all tissues. So you have effects on all of the tissues in your body. The major ones that are affected is your bones. So for long term, having low estrogen, you're at increased risk of osteoporosis, which is bone thinning, and brittleness, cardiovascular disease. So when I was asked about can menopause cause blood pressure, it wouldn't cause it, but it can contribute to your development of it based on your other genetic predispositions. Changes to the body composition, and I had hit on that already in terms of you're starting to gain more weight and it's harder to lose weight, and skin changes, which it will, well, it signals when you start to notice the fine lines and the wrinkles. You might notice dryness to your skin. So it all of that is affected by your low estrogen. The dark patches, thank you, your dark patches and your splotches. So all of these are long-term effects of the reduced estrogen. So osteoporosis. So there's a definition. So it's a condition affecting your bones. And when I say bone mass is what they call bone thinning. And because it's thinning, it's not as strong as it used to be. It's not as strong as it used to be. It's now prone to breaking. So we have all been familiar with the old lady falling and breaking her hip. That's the cause. So for you who asked about early menopause, yeah, you might be end up being a 50-year-old. You're not by an old lady by sense, but you drop, you can break your bone, break your hip bone because of that. So that's one of the things that the long-term effect of it. When I said each patient is different, and a lot of people don't think like this, but in your younger days, you are taking birth control and contraception. And some of how those work is reducing your estrogen. So if you are on certain birth controls for a long period of time, so you would have before your menopause been kind of running a low estrogen, you're more prone to this. So that's why I said everybody experiences menopause differently. So your doctor might ask you that, and you think, why are you asking me about what I was taking when I'm 30? That might be why. Because now we would have to change your management to add something to protect your bones. Next. So everything that I'm talking about is the effect of estrogen. So estrogen is going to delay or reverse it. So when you're having the accelerated bone loss in menopause, it tends to happen in that 1 year before, in that perimenopause, that 1 year of menopause before the final menstrual period and up to 2 years after. So if you come to me, like sister there, and said, I had my last period in 2017. Can I get something from a bone? It's not going to be helpful. You've done lost all of that. So estrogen is not going to help that process at that time. So timing is important of when to start. Next, cardiovascular disease. Now, cardiovascular disease is like everything with your heart and its blood vessels. So that's including coronary artery disease, your high blood pressure, your risk of heart attacks, your risk of strokes, they go up. We as women are less likely to have a heart attack in our 40s than our men because we have estrogen. When we reach the menopause, we almost catch up. So extending our estrogen protects us from heart disease. It's not just, so for the question with the high blood pressure, this is where you're going to realize that it's not really going to be because I went into menopause is why I get high blood pressure. Your high blood pressure is still affected by your lifestyle, your genes, other effects. If you have other conditions, hormonal conditions, adrenal conditions, kidney conditions, diabetes, you still get your high blood pressure. It wouldn't have been menopause's fault. But having the menopause then to worsen it. So you might notice that your medication is going to change or tweak or adjust a little bit. And where menopause has been known and documented in research to affect it is in that, what I said, the coronary arteries. Those are the vessels that feed your heart and your cholesterol. So everybody knows you go to the doctor, you have high cholesterol, the doctor is worried about your heart because the cholesterol is depositing in it. Think about coconut oil. When it gets solid, when it gets cold, it gets solid. That's kind of what cardiovascular plaque would want to be, and it's in your vessels. So if it blocks it off, you're not getting blood flow to your heart well. And we like to call these things fancy names in medicine, so we call them low density lipoproteins and triglycerides. That's typically what those are the bad cholesterols that are going to deposit in your arteries like that. And when you're in menopause and you've dropped your estrogen, those two particular ones tend to climb. So that's where your risk will come in. And when I had said that, I introduce menopause into your well woman visit when you hit your mid 40s. I also introduce screenings for things like this. So you might hear me say, "Oh, we're going to check your liver function, your kidney function, and make sure your blood count is good, and I'm going to check your cholesterol." I'm not just being inquisitive. I want to know for that. So when you hit menopause, if I've seen that your cholesterols have already been off, I'll add you might need some extra cardio protection when you get into menopause. Body composition. So it's not mind over matter. Yes, you're fine, and it's natural. I said you were born with all your eggs, and you have it's like an arc. So when you're in your preteens, you're not seeing your periods, so you don't have any estrogen. When you start seeing your periods, the estrogen climb, peaks in your 20s and your 30s, and then it starts to decline. In your 20s and your 30s is when the figure is perfect. We all look back at our college pictures and we're like, "Why I can't get back to that? Hormones, estrogen, you're not going to get back there." Well, you would, but it's going to be a lot harder to keep it and maintain it than it was at that time. So it's not mind over matter. As you get older, it's harder to maintain weight. And this is particular for women because of that estrogen hormone. Men don't have it. So if you and a man equal body size, age, everything else, go and work out, the male would lose the weight quicker than the female because of that. And so when you've gotten into menopause and your estrogen is now dwindling away, it becomes a little bit more difficult because of what I said is also happening with those cholesterols and lipoproteins, which are fatty. That protection is gone, so it tends to deposit in the area we don't like it, right, dear son? Exactly. And again, just and similar with the osteoporosis, you tend to notice this when you're in your perimenopause. And studies have shown that women who have started hormonal treatments earlier have decreased in essential fat than persons who started it later in their menopause journey. We spoke about the skin. So not all fat is bad fat or things like that. You have collagen. Collagen is what smooths off your skin. You tend to, when you have reduced collagen or collagen issues in your skin, that's when you get your cellulites, you get your stretch marks, you get wrinkles. So when you are having a lesser of a collagen production in that skin area, you tend to get more of those skin changes. And you'll notice it. Start to get the deep lines, the wrinkles, like she said, the dark spots. And this is a little bit less studied because, of course, other things will affect it. Sun exposure, your diet, your skin regime, if you're using your moisturizer. So it's very hard to say, okay, we compared this and this, and this was definitely menopause related because there are other factors that you would have to alleviate that you can't. But they have shown that women tend to have drier skin when they have gotten to menopause. And that drier skin is what contributes to the cracking and the wrinkling and everything else. So that's when they start to sell you all the skin moisturizers and all of that and your vitamin E's. Yes, they are helpful and oily skin. So if you're in your younger days and they want to sell you, oh, you have oily skin and you need this to reduce your keep your oily skin, because it's going to thank you when you get to menopause. And when those three that I mentioned, like I said, those are the three that are mostly studied. Someone had mentioned hair loss. I did not go into estrogen and hair loss because kind of like the skin, you're delving into a very antsy territory. And there are too many other factors to contribute to just say, oh yeah, menopause causes it, but they will say it's not a cause, it's an association, and it generally helps. If that is your complaint, we target that complaint and not jump into all the rest of your menopause treatments. So for my treatment options, I'm going to mostly be focusing on the three big guns that I had grouped together before. So your vasomotor symptoms, your genitourinary symptoms, and the mood. Majority, up to 70% of women, those are the three biggest complainants. And that's what we're targeting when I'm talking about the treatments. So, as I said before, it's not a one size fit all. So, a lot of times persons will come and say, yeah, my friend got this, I want it. You don't know what your friend have. She only knows she tell you, she tell her doctor something else, you can't get it. I'll give you what you need, what's special for you. So it's not something that you're going to be like, I want that because she took it and it worked for me. It might not work for you. So it's very tailored, specific to what you need. And there are plenty of options. So it's kind of like a whole toolkit. And the same three tools that will work for you will not be the same three tools that work for your friend. So we have a lot of mixes. And it's not just, oh, this alone you have to take. We can mix and blend them all up to get you the desired outcome. So everybody's tired of the doctor saying, yes, diet and exercise fix everything, but it's true. And I have kind of associated it with the symptoms so you can see where, okay, this might help. So first thing we're going to go is hot flashes. If you're already hot and sweating down the place, you don't want a hot bowl of soup, you don't want a hot cup of tea. So you might want to avoid those. So I like to tell you my stories. My mother was that type of person. She's a country girl from Manchester. And she always have to have her hot cup of tea in the morning. She don't drink hot tea no more because of her menopause experience. And if you've done something long enough, she can't go back to drinking it. She always makes her tea now and leaves it, go and do something and come back. So that will help with you managing and tolerating your hot flashes better. Some persons like to have a cup of chamomile tea in the night to help them sleep. Remember the hot flashes in the night? You want to keep the body temperature down. So it helps to improve your sleep as well. Exercise. Now you're going to counteract and say, but exercise make you hot and sweaty. So how that going to help you now? Makes you tired. So if you're tired, dead tired, you've gone and you've exercised and you've worked out, you generally might sleep better. You can manage the extra, the low estrogen and the extra body fat deposition. Exercise will help that too. And exercise is not just running up and down. I tell persons all the time, if you want to maintain an exercise regime, find something you like. I am guilty. You see me running up and down, there's a thief running after me. I am not doing it. But I will ride my bicycle from here to North Side and back because that's what I like. And I will get up at 6 o'clock on a Sunday morning to do it. You're not getting me to get up 6 o'clock on a Sunday morning to walk and run nowhere with any of you. So find what you like. And it's not, and think outside of the box. Anybody ever do gardening? Tired and sweaty after that? That can be considered exercise. Outside of the box, yoga. Yoga is exercise, but it's also calming, so it will help with the mood and your relaxation. Swimming. Swimming will help to keep the body down, especially in this heat. The body temperature will come down, so you have swimming. So yeah, it will help with your weight, your mood, your sleep. And if all of these are in all holistic, it will help with your brain health, so you might not feel as upset. This is not menopause related, but I remember my brother having a bad day. We used to share an apartment. He came in one day, door bang, and I just pushed my door because I'm like, he's not in a mood. He just said, I'm going to run. He's a runner, not me. He came back from running. La, 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 la. So exercise does help your mood. And that was I was like, oh my God, it's like a different person. So yeah, exercise has more than just the typical doctor say I have to do this for this. No, it helps you all over. Diet was not only, I didn't put a slide here on diet. In terms of herbal, when I get to the end, somebody remind me to tell you about natural remedies for some of these symptoms. I was supposed to put it here and I forgot. This is now the big guns, hormones. And this is why menopause has gotten a bad name for so long, because for years and years and years, we thought hormone replacement, or what we've now called menopausal hormone therapy, was bad, because research had said that the hormones is going to cause all of these things, and it was bad. And I don't know what the trigger was. People looked back at the data. I like to think it's because we have now more women in healthcare who are experiencing this. More women like me who watched our mother go through it and saw that grandma never said nothing to mommy and mommy was going to hide it from me. Say, no, we're not going to suffer in silence anymore. We are going to figure this out. So there is now more exposure of what we go through. And so more attention to research and benefit for us. And so it was revisited, and we realized the hormone therapy is actually not that bad because it makes sense. If all of this is being caused by I don't have any estrogen, just give it back to me. And that's exactly it. So when we mention hormone, back the old term is hormone replacement, and we still use it. The new term is menopause hormone therapy. And it's generally just talking about that. I'm giving you back your estrogen. It's a little tweak to it. So if you're like my friend, I'm assuming your question, you had a hysterectomy. You don't need anything else, just your estrogen, and you should be good. But if you have one of the drip stop patients and you still have your uterus, you're going to need an additional hormone, which is progesterone. They're all still hormone replacement therapy. And the primary goal of it, so remember I told you that when I'm talking about treatment, I'm hitting the big guns. Primary reason why they came up with hormone therapy is because of hot flashes. So remember when I started out the symptoms and I showed you how hot flashes just kind of triggered down and affected everything else? Kind of like if you fix that, kind of fix everything else coming back down or lessen it. So that's what it was mainly used for. And for the same reason, they found out when we treated the hot flashes, we treat the other symptoms too. The person's reported lesser severity of the other symptoms. So you're likely to get that hormone replacement or your hormonal therapy for that complete. Now, I said it benefited other things, so it doesn't mean that, well, if I don't have hot flashes, the doctor not going to give me a catellar lie now. No, no. You can still get it for other things, but that's the main reason it was researched and studied for. So if you look at the picture, you'll see a lot of different preparations. And that's how many different preparations you have of your hormone therapies. You have pills, you have patches, you have injections, you have rings that you insert into the vaginal area. You have all different combinations. So remember, I said that not because your friend gets it, you need it. You need what benefits you. You may also remember, well, I'll get to it. So remember, I said that this is mostly for your hot flashes, but we prescribe it if you don't have hot flashes either. So if you don't have the vasomotor symptoms, but you have the genitourinary symptoms, we'll still give you hormones, but it might not be a pill or something that is circulating in your entire body. We're just gonna use something more local, like a vaginal cream, because that's your main symptoms, and I don't need to be pumping up your body with hormones for something you don't have. When I had said I had discussed the main symptoms and I said it was 75% of women, there you go. So hormonal therapy will be discussed in 75% of patients' visits. And we're not reached the 75% prescription rate yet, but we'll get there. So this is what we're talking about. You have various methods of giving you estrogen. So you might get a pill, you might get a patch on the skin. We don't have it here, but in another country, you might get it injectable. In terms of, I'm not having hot flashes, doc, but I'm having recurrent vaginal infections. I'm having recurrent bladder infections. I might choose to give you a vaginal cream. I don't think we have it here, but there's also a little ring. So you can insert a little ring that stays in for a month, and it just slowly releases the hormones you need vaginally. So there are different ways of getting it, and we call it systemic and we call it local. So systemic is a patch or a pill that is going to cause the hormones to circulate around the entire bloodstream, and that's why we mostly use those ones for your vasomotor symptoms, which remember is your hot flashes. If you're saying no, my symptoms are more local, then you'll get the cream or the patch or the insert, which we call local hormone therapy. This, when I was speaking from the previous slide, I was talking about estrogen. Now, The first thing the doctor is going to need to know is, do you have a uterus or don't you have a uterus? If you do not have a uterus, the first slide is all you need in terms of hormones. If you have an intact uterus, this is where your next slide comes in. Estrogen is responsible for thickening the lining of your uterus and making you bleed. So if you still have a uterus and we give you estrogen, the uterus is still there and it's going to respond to the estrogen and the lining is going to thicken and you're going to bleed. Nobody figured out what I was saying yet, but you'll ask. But yes, while I'm menopausal, you said that it stopped. Yeah, but it can be restarted if you give it enough hormones. And we're giving you high doses of hormones so it can start back. It's not normal. It shouldn't happen. And so the progesterone comes in to protect you from that, because if we leave it unchecked, it can lead to uterine cancer. So if you have a uterus and you're getting estrogen, we have to protect you from that. And there are two ways in which we can do it. We can give you pills, or we can insert an intrauterine device. Both of them have progesterone hormones given to protect your uterus. And that's your hormone treatment, pretty much in a nutshell. The different formats and different preparations is tailored to your needs. So here is where I'm going at. Nothing is all well. So remember I told you that menopause and hormone treatments got a bad rap? That on the screen is why it got a bad rap. Some persons are at risk of these things. So that's why you can't get what your friend gets. So my lady here who had asked me about breast cancer, if you're actively going through breast cancer treatment, you can't get this. My next slides will apply to you, but hormones are not for you. If you recently had a heart attack and recovering, can't have this. If you're having a blood clot, you have a history of, I have a clot in my chest or I had a clot in my leg. Your doctor might say, I don't want to give you systemic treatment. I might just give you local, because that's less likely to go around in your bloodstream to cause you problems. So that's why it's important to individualize your treatment. It's not all, just give it back and you're fixed. There are side effects and risks involved. So you have to talk to your physician about that. So that's what I was just basically emphasizing. You have to go and speak to a physician about it. So of course, if I have all of these things, that means I'm out of the woods and I cannot help? No. There are alternate treatments. They're not, fixing the cause of the problem, but they're now fixing the symptoms. So if you can't get hormonal treatments, or if all you have are the mood symptoms, I'm not going to pump you up with hormones unnecessarily and putting you at risk of things if you don't need it. So here's where you come in. So we actually do give you antidepressant therapies. Now, this is not because we know. Remember, I said you come and you do your history, and I told you about that co-worker who came and said she's bawling down the place and she thought she was depressed. This was what I offered her. I was not going to give it to her in the normal dose that you would give somebody who is clinically depressed, because it's a different pathology. So the doses are different, but the medication is the same. This is a lot of stigma, because there's still a stigma with mental health, and I had to let her know that I can try you on this. I don't need to consult the psychiatrist for this, because I don't think you're at the point of that. And it's a try for you to hold the fort until you consider your hormone treatment. And she tried it and she called me back 1 week later. I don't want it. I gave her the hormones and I said, okay, you had a 6-week appointment. 1 week is gone. Try this. When she came back, she was like, it's fixed. So you see that these are just treating the symptoms, but the hormonal treatment still works a little better. So we'll still try to give you that, but we'll only not if there is seriously a problem why we can't. And these are still being combined with your regular exercise. So even if I give you the menopausal hormonal treatment, I'm still going to want you to exercise, do your yoga. If you want to go to counseling and support groups, that helps. So yeah. I told you about antidepressants before. We have anxiety medications. Remember I said anxiety was one of them. You had to feel panic. Oh my God, do they notice I'm sweating? So then same handling of it. I'm giving you an anxiolytic. You take it at night. It's going to help you sleep. It's not in the dose as I'm giving somebody who has a diagnosis of anxiety. Another one out of the box. It's a fancy word, gabapentinoids. Somebody might hear it, gabapentin. It's given for some kinds of pain, some kinds of nerve pains. So if anybody has a nerve condition, they may have gotten that. It actually helps as well with your hot flashes, and it has been shown to be successful in up to 70% of females. So there are options. If you don't want to have your hormones, we can use something else that is pretty effective. Remember, this is not everybody. So if I give it to you and say it's up to 70% effective, you might be in the 30%. Don't get upset. We're going to go back to the drawing board if you come back and it's not working. Another fancy word, oxybutynin, that was an medication in the past that was used for urinary incontinence. So we'll use that to treat your genitourinary symptoms. If you're a person who is finding that I'm getting up, I'm passing all this urine, and it's not a pelvic floor issue, we'll use that, and it also helps to reduce the hot flashes. Not as effective, 40%, because it's really an older drug. And clonidine as well. These are all out of the box. Medications, it's usually used to treat hypertension, but again, it helps with your night sweats. Why am I not remembering the medic? See, I have a brain fog now, not perimenopause. Rogaine, I think you remember Rogaine. Minoxidil. So minoxidil is used for the hair. But if you look up when minoxidil originated, it was also a hypertensive medication that we use in menopause, but we use it for hair loss. So you see that we're using things that you will look at what the box, it's not prescribed for this, but we use it because of the other effects of it. Before we get to there, I had said that I forgot to put a slide. You knew I was going to do that. So my mother, despite looking like she's having a heart attack in the people's store and giving me a panic, I went and did all my research. I said, Mom, you can take this and you can take this. I don't want it. Okay. And she basically did lifestyle changes and to a lesser extent, natural methods. So that's where I had to go back to the drawing board. It's not something you're going to find in a general medical book. It's something I had to go into like naturopathic medicine and stuff. And I've actually, and I'm willing to say this, and I tell my patients this, I've guinea pig them. I can't take it, I'm not going to know if it works. But I have a patient right in front of me. You want to try this and come back and tell me how it is? Some of them are very willing, and they've come back and they've told me that black cohosh is helpful. They've told me pumpkin seed oil, so you get it like how you get cod liver oil at a natural food store, that helped with their hot flashes. Notice I say helped, not disappear it. You're still going to get it, but instead of waking up 7 times for the night, it might be 2. So pumpkin seed oil was one. I didn't come up on this one. More than one patient actually told me this one. I've never seen it. I don't know. I just can't find it. But something called Lydia Pinkham. Don't know if anybody here knows that one. That helps. She can tell you.
I'll tell you, Lady Pinkham.
Something Lady Pinkham, Lydia
Lady Pinkham.
Right. That's what patients have told me that one. Because I can't even pronounce it, much less spell it to research it properly. But they have told me that that's helpful. For the breast tenderness and the soreness, you'll get evening primrose oil. In terms of diet, things with a lot of grain and seeds. So flaxseed. I noticed I started to see my mommy sprinkling that on her ice cream. So yeah, you have these little flax seeds and stuff like that will help with your diet. And I'm forgetting one. Soy. So soy came in a group of, I don't know what you call it, plant molecules that they call phytoestrogens, which is a fancy name for plant estrogens. They mimic estrogen. And so they'll say if you increase the soy or soy proteins in your diet, it may help with your symptoms. It was a little bit tricky, and it was a caution after a while when they said, yes, it mimics estrogen so well, it can mimic it in your breast, and was not um, recommended for persons who have a strong family history or have breast cancer. So use that one sparingly. And yes, from the top of my head, those are the natural remedies that I've had research, looked about, read up, and they actually helped. And one other thing I forgot in the lifestyle change, my dearest mother, who said she wasn't taking anything, back in the day, we didn't have Stanleys, but she had something that mimicked a Stanley that you could corkscrew up. And for her hot flashes, she filled it up with ice, put a little rag in it, and corked it up. And whenever she had one, she took it out. So, when you go to the fancy hotels and they give you a cold rag. So she made her own and she'll sit there and she just puts it on her chest, puts it on her back, tap herself. And that was it. And she did that for a year and she went through, I'm not looking forward to it, but she went through it like a trooper. I don't know if she was just hiding it, but after a year, her symptoms left. There are other persons who 5 years, they're still having symptoms, up to 10 years. So don't think because this should be done by now. You can have research has proven that your symptoms can last up to 10 years. Now, I started by saying this was something natural. You can't hide from it. It is expected, it is coming. And the best way to tackle something you know is coming is by knowledge. And that's what I do to help my patients. I let them know. So they're not going to be like my mother, who is like, my mother never tell me, I don't know. You know. And you know how to expect it, how to know about it, and how to treat it. So you no longer have to struggle with your menopause alone. There is hope. There are many treatment options. You don't have to take hormones if you're hearing that. It don't sound comfortable to you, all of the risk factors. And all you have to do is simply have a discussion with your doctor. And that's it. Any more questions?
Okay, I have a suggestion actually. I saw a video out of I think it's HNK in Japan, and there was this doctor who did some tests on osteoclasts and osteoblasts for osteoporosis. So what his recommendation, as he said, as we get older, this goes for men as well. As we get older, the osteoblast increases, but the osteoclast decreases. And basically, what that is saying that these two cells that are going over our bones repeatedly. But as we keep getting older, the osteoblast is the one who's actually destroying and creating holes within our bones. The osteoclast is the one that goes back over that and replaces it, but that decreases while the osteoblast increases to make the holes. However, what he found is that when you consume soy along with kiwi, which is high in vitamin C, it helps the osteoclast to reactivate to build back the portions of the bone or the bone density, you would say. Another thing is too for a recommendation is Anna's wild yam cream. I don't know if you've heard of that. Okay, this one is out of Australia, and it's this lady by the name of Anna. But the actual natural remedy herb, or yeah, it's a herb, wild yam cream. Wild yam cream. But if you go online, like I said, it's from Australia. So you can order it. I think you can get it on Amazon. I'm not quite sure, but it's called Anna's Wild Yam Cream. Also, anything with caffeine triggers hot flashes.
It was on the slide, yep.
So all the chocolates that you like has caffeine in it.
Dark chocolate.
Yeah.
So if you get more milk chocolate. Yes, but yes, you're right.
Yeah, dark chocolate, yeah. Or coffee, or anything, sodas, anything that has caffeine
And some
in it.
green teas have a lot of
And
caffeine.
green tea, right? All that has caffeine in it, and it would trigger your hot flashes. I've actually had someone sit next to me, like what she talked about with her mummy, having the sweat pouring off of you, like you're actually running a marathon, and we're sitting in AC, and this lady is just pouring down with sweat. I was in Tampa, and my cousin's girlfriend, she was going through menopause, and I saw this literally. I'm like, "What's wrong with you?" She said, "This is menopause, girl." I'm like, "Wow, I don't." My mother took Pinkham, and she didn't really have any issues. So when I just give my little testimony. When I started, which I didn't have no hot flashes or anything, and I have this prescription nutritional healing book, and it has a slew of recommendations in it for anything, basically any illness that you'll have. So it categorizes them in what is very important, and helpful, and then it goes into like the herbs and your diet and everything like that, right? So I started to research everything, and I took everything that I could possibly take. I did not have no hot flashes. The only thing that I contribute to that may be a little morning stiffness and a little joint pain now and then. But other than that, yeah, the black cohosh as well is very good. And also remember the ginkgo biloba for your brain. Yeah.
I needed to add to what you had said. Osteoporosis, and I just went through um, broad spectrum. There's also a genetic component. Us with more African descent, we start off with thicker, more dense bones. So we are lesser at risk of it, but not out of the woods. And one of the best recommendations for bone health is weight bearing exercises that you start in your perimenopause, if not better, before. And weight bearing exercises is weightlifting pretty much. So you start doing little heavy lifting, and that will be very helpful to your bone density. Right. Osteoblasts. Okay. Thank you.
All right, thank you so much. I am really thankful for you coming here today doing this presentation because the men in the room are extremely attentive to the information being presented. So we know that we will be very good in assisting those who may be through this, who will be in our midst. With that, I have just a couple of questions, some that were sent to me, and I just want to make sure that I ask them. So the first is what I'd asked earlier, switching of hormone therapies,
Yes.
if it would actually increase symptoms of menopause,
Switching
Yes.
or
like
dose
changing brands or
changing?
changing
Oh,
doses.
brands. Yes. Yes. So I tried to stay very non medical to make it very understandable. So when I said there were various preparations, I didn't mean only in how you get it, in types. So you have types of estrogens, you have types of progesterones, and they're selected based on also your risk factors. So you might find that some progesterones are more linked to breast cancer than some. Um, so you'll choose a different, what we call a progestogen. You have synthetic, you have natural. So you'll have some that are like from bovine, some that are made in the lab. So yes, you can change your preparation, and it can change how you respond.
Okay, my second question of three. You had mentioned earlier about the 1 year period of symptoms, which could be extended to up to 10 years. Just wanted you to reiterate that for someone who may have missed you saying it in terms of the time frame for
Okay.
menopausal symptoms.
So your symptoms start in the transition period or the perimenopause, which is average age mid to late 40s. And they worsen in your menopause, which is that 12 years of absent menses. And then it trickles back down. 12 months. I keep saying 12 years. I'm so sorry. But I'm glad you're listening to correct me. It was a test. Right. So it's worse in that 12-month period. And then afterwards, it trickles down and stops eventually. But your trickle down and stop period can be as short as 1 year or as long as 10 years.
All right. For the final one, for this one, this person, they actually gave a history and then asked a question. So She's had a tubal ligation, endometrial ablation, hysterectomy, keeping her ovaries. She has been suffering from 2016 and was undiagnosed. And in 2023, she started a hormone therapy. She says she's tired of feeling horrible and is not coping mentally. It's like she says she's on a roller coaster. And the question she has is, does a woman actually feel better over time?
Yes, they do. Unfortunately, for the person who wrote that question, and I never wrote it, out of all the types of menopause, surgical is the worst. And the reason it's the worst is, I don't remember the analogy I'm trying to look for, the saying I'm trying to look for, but for persons who go through it naturally, you still have your ovaries. They're not dead. They're still there. They're still producing hormones. They're in a small amount. So if I was to go and you are 10 years postmenopausal and I do a blood test, I'm going to find estrogen, I'm going to find progesterone, I'm going to find testosterone. But when I take it out, I find nothing.
She has her ovaries.
Oh, she has them.
Yes.
Oh, I'm sorry. I thought she took it out with. Well, it's good to know that. So that's one. Two, everybody is different. Maybe hormones are not enough for her because she mentioned she's on hormones. Remember, I gave a whole list and I say you can mix and splice depending on your effect. So she might be one of those patients that I do it differently for what your presenting complaint is. So my coworker who came and her presenting complaint was mood disturbances. I started with mood medications and say, see if this works. It did not work. I switched it out. Then I gave the hormones. She was lucky and I was lucky that worked. She could have come back and be like, it worked, but I'm not there yet. And then I might have chosen to add back the mood because she might just need that extra push. And you might have to just combine things. And you should never underestimate the power of the other things, your exercise, your diet, your personal relationships. Stress is big. Stress is a big aspect. Stress affects your menopause symptoms. Stress affects your PMS symptoms. It worsens it. So especially since hers is mood related, those are things to think out of the box of and to find out, do you need like stress management? That's a part of menopause therapy, stress management.
Awesome. So my last question on this block is, with all that was presented, if someone is interested in a consultation with you, what is the best way to contact you for an appointment?
Savannah Medical Clinic.
Say that again.
Savannah Medical Clinic at Country Corner.
Yes.
I should have made that on a slide. Thank you. I will put it on a slide. But I'm at Savannah Medical Clinic at Country Corner in Savannah, Mondays to Fridays and Saturdays by appointment.
Thank you so much. That concludes my
Wait,
questions.
one thing. I was hoping somebody was going to ask me this. So there are two things I always add. One is, remember I say when you go through menopause, you're postmenopausal for life. I have had patients come back and say, Doc, guess what? The periods come back. That's not your period coming back. That is something wrong. They don't come back. If you've gone through 12 months and have no periods, and at the 18-month mark, you start bleeding again, do not think to yourself at home, oh, it come back. Let me just wait it out till it go again. Please find your doctor. Something is wrong. Second, remember we spoke about your perimenopause? And we said that your fertility dwindles. It's not gone. I remember very early in my career, I'm not as young as I look, so I looked even younger than this, and I started young. And she came, I was doing public health, I was working in a community clinic, and she came and she's like, Doc, I think I reached menopause. Proud of herself. I said, why? So I don't see my periods. And my breast tender. So I feel nauseous. I don't have no appetite. And the more she spoke, the more my eyes just opened. And the first thing I asked her, well, did you do a pregnancy test? Doc, I'm 49. She's talking about. Look a young doctor them here, She's going on. And I said, but you didn't answer me. Did you do a pregnancy test? No. I said, I think you're pregnant. And she looked at me in shock. She says, no, I'm nearly 50. I'm 49. It's menopause. And I said, all right, we're going to do a bet. You're going to go and you do a pregnancy test. And if it's negative, you're going to come here and you can laugh at me if you want, that I'm the young doctor who is inexperienced. But if it's positive, you're going to have to come back for your pregnancy, for your, transfer, because we don't manage. Where I was, we didn't manage anything pregnancy. She never came back. So yes, you can get pregnant in your perimenopause. And that is one of the things that I do for my patients when I've started their counseling. So remember, I tell you, your well woman visit, that's when you just come to your doctor for your checkup. It changes with your age. And from you hit to 45, you always have birth control in there. When you hit to 45, I discuss that. Are you on birth control? Do you need it? What are you on? I hardly ever likely stop it because I don't want anybody in their late 40s, early 50s to have a baby and try to tell me it's your fault, you take it. I'm not taking it. So it is safe for you to be on your birth control straight up until. Those are the two things I forgot to add. Okay. So, sorry.
I heard that moringa,
Moringa.
irvine are very good
Mhm.
hormone balancing herbs that can be
Okay.
taken. Individuals who took them and experienced good results.
I can try guinea pig some more of my patients. But I know moringa is very new. It's like one of those new superfoods that have 1,000,001 benefits. So yeah, I wouldn't be surprised if that's one of the benefits of it. Oh, okay, well, thank you everyone for having me and
I have another question. Okay, people want to hear. Okay, I have another question. Doctor. Okay, what I'm saying is that you don't talk anything about pap smear because it is not in your,
oh
it is not in your,
it's not in my
not in your
presentation, no. But
presentation.
yes, you do still need, just like how you would still need your birth control up until menopause, you still need to do your pap smears into menopause and after.
Yeah, because
If you have a uterus, if you have a uterus, if you don't have a uterus, you don't need a pap smear.
okay. So what I'm saying is that me now, like me now, I'm not with a partner or anything like that.
Mm-hmm.
So I'm living now for the Lord. So for me now, it is right for me now to, whenever I'm ready again with my partner, it is like oil.
Part of the genitourinary syndrome
Yeah,
of menopause is increased vaginal infections.
yeah.
And yes, that will be something you'd have to see your doctor for
Oh, yeah.
to treat whatever
All
it
right.
is.
Okay, doctor. Love you, and I come in to see you. Okay.
Okay, thank
Bye.
you. Yes. Either, because I don't. You're not changing the. It's just changing the form in which it's presented. So flaxseed or rubber, just put it in like a blend and grinded it up to get the powder, so it will still be the same effect.
Thank you so much, Dr. Reeves. Did you enjoy the session, ladies and gentlemen? Yes, and I think we need a part two because the men were very attentive and they have a lot of questions, but the time. So, doctor, we need to set a part two because one young man behind me, we were talking about the andropause too. So, yeah, for another session, we can organize, maybe through you, maybe you can connect us with somebody because we're all in this together. So, on behalf of the Women's Ministries Department of Berea, Seventh day Adventist Church, we would like to present this talking to you, thanking you for taking time out of your busy schedule to come and present to us. It was very informative, and I'm sure that everybody learned something that they can go and apply to their own lives if they experience any of these symptoms, or they can share with somebody who they know who's struggling. May the Lord continue to bless you as you continue to give of your service.
Thank you so much for having me.
It's a pleasure. So I just shared Dr. Reeves' information. I just shared the flyer. Ladies, please check it out if you need to see her. The location, the contact information is there. Please use it up. She seems to be very educated. She knows what she's doing, right? Yes. All right, I hand over now to Elder Josh to take it from here.
All right, there's not much handover. We have learned a lot. We want to say on behalf of the leadership of the church how much we appreciate Dr. Reeves coming. And I know Sister Nadine Tomlinson, Sister Nadine has a lot to do with this. And we were just talking there and we said that this was from menopause. And the men paused to listen. So the next time it will be andropause. And we almost identify who will be asking to come to address us. And so we really want to say a big thank you, Sister Nadine and Dr. Reeves, and also to the Women's Ministries Department of our church. When we have knowledge, we are better